Hello everyone, my name is Michaela Kyle and this presentation will be an overview of the Framingham Heart Study. This study is known to be one of the most impactful studies regarding the risk factors associated with cardiovascular disease. It is one of the longest run studies. It began in 1948 and it continues today. A vast majority of the knowledge we have today regarding cardiovascular disease was discovered by investigators using the Framingham Heart Study. NHLBI created a longitudinal teaching dataset that consists of clinical, laboratory, and outcome data on 4,434 participants. To begin this presentation, we will discuss a description of the study sample. As stated previously, there were a total of 4,434 participants. Of those 4,434 participants, the average age was 49 years old with a standard deviation of 8.6. 1,944 participants are males, averaging about 43.84%. The mean diastolic blood pressure among participants is 83.08 with a standard deviation of 12.06. A good amount had hypertension, numbering 3,252 of the 4,434 participants. That is about 73.34%. Only 144 participants use antihypertension medication. The mean number for cardiovascular disease is 2,181 with a standard deviation of 49.2. The mean total serum cholesterol was 236.98, averaging 44.7% of the participants with high cholesterol. The mean serum glucose was 82.18632 with a standard deviation of 24.4. The mean number of stroke patients was 1,156, meaning that 26.09% of participants are stroke patients. On this slide, we will discuss the characteristics associated with heart rate and the interpretation of regression analysis. The characteristics listed on this slide consist of age, male, sex, glucose, total serum cholesterol, current smoker, and diabetes. We can see from the p-value on the right that age and diabetes are correlated to heart rate, and the others seem rather insignificant. We can confer from this slide that age and diabetes play a role in contributing to a change in heart rate. Next, this slide will discuss the interpretation as to why some likely have prevalent coronary heart disease. This chart compares 194 participants with a history of coronary heart disease to the 4,240 participants with no history of coronary heart disease. The characteristics compared are age, systolic blood pressure, diastolic blood pressure, total serum cholesterol, and body mass index. Simple and multivariable linear regression analysis were used to complete the table relating the characteristics listed to heart rate, beats per minute, as the continuous variable. Alpha was 0.05 and all of the p-values were less than alpha. This means we can reject the null hypothesis, which checks for significant differences. There is a significant difference of risk factors in patients who have a history of coronary heart disease compared to those without. Age, systolic blood pressure, diastolic blood pressure, total serum cholesterol, and body mass index all play a significant role in affecting a patient developing coronary heart disease. As stated previously, the Framingham Heart Study is a case study done to collect data on risk factors for cardiovascular disease. It is one of the most influential case studies ever run, and it continues today. NHLBI created a longitudinal teaching dataset that consists of clinical, laboratory, and outcome data regarding 4,434 participants. In this slide, we are going to discuss the interpretation of data collection methods used throughout the study and compare them to other best practices. The Framingham Heart Study utilized the longitudinal study design. This is a type of research design that consists of repeated observations of the same variables over long periods of time. This case study followed the participants over the span of 6 years. Following participants over a long period of time allows researchers to better understand what risk factors lead to disease development. They started following participants in 1948 and continue to monitor individuals today. The participants agreed to undergo annual physical examinations, blood pressures, cholesterol levels, glucose levels, smoking status, and stroke risks. The participants are also screened for past medical history, family history, informed consent, etc. A benefit of longitudinal studies is that researchers can track changes that occur over time as participants' situations change and they age. Over time, participants experience changes in social, financial, and economic changes, which the longitudinal study designs can assess for. Researchers can better understand development and changes over time, making it a strong study design. Longitudinal studies differentiate between cohort and age effects, which reduce recall bias and strengthen longitudinal study designs. Longitudinal study designs provide comprehensive data that assesses changes over time, making them a highly recommended and valuable research tool. The Framingham Heart Study has been widely used and discussed throughout the media. A majority of what we know regarding cardiovascular disease was actually founded by investigators in the Framingham Heart Study. This case study has appeared in high-impact, peer-reviewed medical journals. So that is the end of my presentation, and I hope that this was a beneficial explanation of the Framingham Heart Study. I hope that you were able to gain valuable information regarding cardiovascular disease.